this is Dr. Harris. Thanks for watching. Today's topic is going to be about adjusting techniques. 41 years ago when I started, I used the traditional hands-on manual manipulation technique. That's called diversified, and that's what the majority of chiropractors even do today. But the development of this impulse adjusting instrument has made adjusting more sophisticated, and there's more science behind this than any technique. So it's getting the best results, it's gentler, it's more thorough, because it puts out a series of rapid impulses, and when carefully placed, it stimulates the nervous system that controls the muscles, the neuromechanical receptors and the muscle spindles. And so in English, that's like pushing reset buttons for balancing the muscles. So we do it repetitively, series, and that balancing the muscles over and over and over will improve the alignment of the spine. And it does it in a very gentle way with the patient just laying there. I don't have to move the patient around like with the manual technique. And I've had a number of patients tell me that if I'd have used this technique, if they'd have known about it, they'd have come in a lot earlier because they were afraid of the manual technique. So I'm trying to get the word out. This is a sophisticated new adjusting technique, more gentle, easier on the patient, easier on the doctor. And to give you an example of how effective it is, I had an 85-year-old woman with a scoliosis like that, and the only technique I used on her was for adjusting was the impulse instrument. And after a series of treatment, the apex of the lowest curve flattened 5/8 of an inch, and the top curve 3/4 of an inch, almost straightened up an 85-year-old scoliosis. She was saying halfway through the treatment that she was breathing better because the ribs attach to the spine, and when the spine distorts, the ribs distort, which affects the lungs and the heart. So I was amazed at how effective this instrument is for making structural correction. The impulse instrument has 3 adjustable strengths. This is the strongest one, and the medium one, and this is the mildest one. It's so mild I can use this on infants or on acutely injured people. I've even used it on a woman who had a rod put in her spine from here to here on both sides. It's the only thing I could have used on her. Her muscles were hard as stone, and her diagnosis was dystonia. And in 2 weeks, I had her muscles back to normal. So that's another advantage of the impulse instrument, is I can use it on anybody, on any occasion, without any possibility of harm. So keep that in mind if you have an apprehension to manual manipulation. It's gotten a lot gentler and more sophisticated, and you might spread the word, because there's a significant number of people out there that are afraid to come to a chiropractor because of the technique that they see dramatized on TV and over exaggerated, and they've heard that it hurts people, which is not true. But just want to introduce the impulse adjusting instrument. I've been doing it for 3.5 years now, and it's a wonderful new development in chiropractic. Thanks for watching. This is Dr. Harris.